It's important to consult with your healthcare provider about other possible symptoms that appear severe or concerning if you think you or a loved one has the flu.
Hi, Dr. Kevin Soden here with 6 ways to stay well this cold and flu season. First, get plenty of sleep. You need 7.5 to 8 hours every night. That helps keep your immune system humming. Get enough vitamin D3. Take 1,000 units a day, 1,200 after age 60. Manage stress. Chronic stress takes a toll on your immune system. So carve out 10 minutes a day for meditation and deep breathing and serene stretching. Exercise. A daily walk also helps bolster your immunity. It's a great stress buster too. Eat right. That means lots of colorful fruits and veggies, lean protein and whole grains. Wash your hands a lot. And if you do come down with a cold or the flu, do yourself and your coworkers a favor and stay home. You'll recuperate more quickly and help keep everyone else healthy.
If you have the flu, a sneeze or cough is only the beginning. People can experience some or all of these symptoms. Cough, sore throat, fever, runny or stuffy nose, fatigue, chills, and headaches. The flu can be a very serious illness for those who have higher risk factors, including people over the age of 65, pregnant people, children younger than the age of 5, people with chronic medical conditions like diabetes, asthma, or heart disease. Symptoms of the flu to look out for that require immediate medical care are dehydration, or in children, not being alert or interacting when awake. In adults, persistent dizziness or confusion or inability to arouse, chest pains or severe muscle pain, trouble breathing, discolored lips or nail beds, even seizures or persistent pain and weakness, a fever or cough that improves but then returns or worsens, and in adults, a fever over 104 degrees Fahrenheit. Fevers can be a sign of a serious infection, especially in young children. You should seek medical help for your child immediately if they are 3 months old or younger and have a fever of 100.4 degrees or more. If they are younger than 2 years old and have a 100.4 fever that lasts over 24 hours. If they're over the age of 2 and has a 100.4 fever that lasts more than 3 days. Or if they're 3 months old or younger and has a 100.4 degree fever or higher fever of 100.4 degrees. It's important to consult with your healthcare provider about other possible symptoms that appear severe or concerning if you think you or a loved one has the flu.
Why are folks so adamant about getting the flu vaccine? Well, to put it simply, the flu vaccine triggers antibody production, which protects you and your loved ones from getting the flu. The flu can be serious, especially in young children, pregnant people, and people with chronic medical conditions. In those people, it may lead to more severe illness or even death. It's recommended that you get your flu vaccine by the end of October, so your antibodies are ready to do their job properly. There are multiple flu vaccine options that are best suited for different age groups. Find where you fit in and get the flu vaccine. The flu can kill many people depending on how strong the strain is for the season. So make it a tradition to get your shot every year.
Unfortunately, with COVID-19, you can have the virus and show 0 symptoms, or you can show symptoms similar to the flu. We used to think when we coughed or sneezed, a cold was coming on, or worst case, we had the flu. Nowadays, we have COVID-19 to worry about, and differentiating between these illnesses can be tricky as their symptoms can be similar. The common cold displays gradual symptoms, meaning that you can detect that a cold is on its way days before it actually arrives. With a common cold, you'll usually experience things like sneezing, stuffy nose, sore throat, a mild cough, and it will generally go away on its own in a few days. COVID-19 and flu symptoms are more severe. If you have the flu, symptoms usually arise abruptly. Unfortunately, with COVID-19, you can have the virus and show 0 symptoms, or you can show symptoms similar to the flu. The flu is easier to detect, unlike the COVID-19 virus. The best way to rule out one or the other is to get tested for COVID-19. Now, there isn't a vaccine for the common cold, but there are vaccines available for COVID-19 and the flu. It's important to note that all 3 illnesses are contagious. So if you believe you're sick, it's best to stay home and avoid contact with others.
The flu is bad enough on its own, but in some cases, it may make a bad situation worse. It can cause sinus and ear infections, and it can also lead to life-threatening illnesses like pneumonia. Pneumonia is an infection in the lungs, where the air sacs become inflamed and may fill with fluid or pus, leading to difficulty with breathing. It can be brought on by the influenza virus alone, or it can be the result of a combination of influenza and bacteria. This is why it's important to wash your hands as often as possible and keep a safe distance from people who are sick. If someone has chronic medical problems such as asthma or chronic heart disease, contracting the flu can cause asthma attacks or worsen heart conditions. The flu can trigger inflammation of the heart, brain, or muscles and lead to sepsis. Sepsis is an inflammatory response in the body to an infection. It triggers a chain reaction that can lead to organ failure. The flu is a very serious illness, which is why it is stressed that everyone get their flu vaccine each year.